Welcome to the Deep Dive. Today, we're really digging into something pretty fundamental that's changing in healthcare.
Yeah, how technology isn't just, helping out anymore, but actively reshaping things like quality of care and patient safety.
Exactly. And you've brought us a really interesting mix of material stuff from big accreditation bodies like Joint Commission International, JCI, and India's NABH.
Right, and also the global view from ISQA, the International Society for Quality in Healthcare, plus some real practical insights on tech for quality improvement, QI.
So the mission here, our goal for this deep dive is to sort of weave these together. We want to pull out the most important bits for you, our listener.
How are these big organizations and the tech they're pushing actually making healthcare better and safer? Cut through the noise, get to what matters.
Okay, let's jump in. Looking at these sources, it's clear these accreditation bodies are, well, foundational. Let's start with JCI, Joint Commission International. That's a huge name globally, right?
Huge. Yeah, definitely a leader. They're working in, over 70 countries, accrediting and certifying more than 1,000 programs. It's pretty impressive.
And their mission is simple but powerful. Enable and affirm the highest standards of healthcare quality and patient safety for all. Very direct.
It is. And what's interesting is how they do it. It's not just about stamping and approval, They offer specific certifications, too, like for clinical care, even telehealth now, which is growing so fast.
Telehealth, yeah. And sustainability, too, I saw.
Sustainability, advisory services. And maybe most importantly, they develop those international patient safety goals. Those are real benchmarks used everywhere.
The sources mentioned quotes from hospital leaders, didn't they?
Yeah.
Hong Kong, UAE, praising JCI for helping with team building, coordination, even boosting community confidence.
Exactly. It builds trust, improves risk management, fosters that culture of safety. They even have a big conference, Unified 2025, coming up in D.C., and resources like webinars, their newsletter, JC Insight. They're really active in sharing knowledge.
Okay, so that's the global giant. Then we've got NABH, the National Accreditation Board for Hospitals and Healthcare Providers in India.
Right, part of the Quality Council of India. Their focus is specifically on setting up accreditation programs within India.
Tailored to the Indian context, then.
Precisely. Setting benchmarks for the health industry there, aiming to build that ecosystem for quality, as they put it. They publish their own standards, highlight the benefits for Indian providers. It's about that national focus.
Got it. And then there's ISQA, the International Society for Quality in Healthcare. Different model, you said?
Yeah, they're member-based, nonprofit, been around for over 30 years, really focused on promoting quality improvement worldwide.
How do they do that mainly?
Education is big for them, sharing knowledge. They have an external evaluation arm called IEEA, but mostly it's about supporting health systems globally and connecting the people working in quality improvement, building that network.
And they're global, too. Over 70 countries in their network.
Yep. And they also have a major conference coming up, Sao Paulo, in 2025. The theme actually ties right into our discussion. Inclusive health systems, navigating challenges with technology and humanity.
Perfect fit. Technology and humanity.
Right. And they contribute a lot through research, too. Journals like IJQHC and IJCOMS, white papers on patient safety, really adding to the evidence base.
So putting it together, we have JCI setting broad international standards.
Yeah.
NABH applying similar principles within India's specific needs, and iSquad kind of fostering this global conversation and knowledge sharing.
That's a really good way to look at it, a layered approach. And running through all of this, and especially highlighted in the other materials like that QI playbook transcript.
Technology.
Exactly. Technology is absolutely central now, especially electronic health records, EHRs, and quality management systems, QMS. They're not just nice to haves anymore. They're pretty much essential for serious QI work.
Okay, EHRs. Let's break that down a bit. These are basically the digital patient charts, right? History, labs, treatments, all in one place.
That's the core idea, yeah. But they're way more than just digital files. The QI playbook source really emphasizes this. Think about getting immediate, real-time access to all that patient info. That's huge for quick, informed decisions.
Right. No more hunting down paper charts.
And standardization. EHRs can have templates, guidelines built right in. It helps ensure everyone follows best practices, kind of like having a standard recipe, reduces errors.
Makes sense.
Yeah.
And integration. pulling data from labs, pharmacy, imaging.
Yes. So clinicians get a complete picture, not just silos of information. And maybe the biggest thing for QI is the data analytics potential.
Ah, right. Using all that data collected.
Exactly. EHRs generate tons of data. You can use it to spot trends, see how effective treatments are, find gaps in care. Like, are patients taking their meds? What are the surgical complication rates? How satisfied are patients?
That sounds incredibly powerful for actually seeing where the problems are.
It really is. And that leads us nicely into QMS quality management systems.
Okay, so if EHRs are the data source, QMS are the tools to manage and improve based on that data.
You got it.
Mhm.
They're tech platforms specifically built to help organizations monitor, control, and improve quality.
So practically speaking, what does a QMS let a hospital do?
Well, the playbook gives good examples. You can track key metrics on real-time dashboards, see patient satisfaction scores, readmission rates, safety compliance instantly.
Okay, so immediate visibility.
Right. Plus, many QMS automate things like compliance checks and audits. That saves a massive amount of admin time and reduces human error in those really critical checks.
I can see how that frees people up. Less paperwork, more patient focus.
Absolutely. And they helped structure improvement work using frameworks like PDSA Plan to Check Act.
The continuous improvement cycle.
Exactly. QMS platforms often have tools to manage that whole process. Identify a problem, plan a change, implement it, check the results, act on them systematically. They also help different departments collaborate better on these projects. The sources even name drop specific systems like Qualio and Viva Vault QMS.
And we have that great example from the playbook transcript, don't we? The hospital network.
Oh yeah, the medication errors one. That was compelling. They used their EHR data, found a pattern of errors during shift changes.
Mm-hmm.
Then they used their QMS to dig into why, roll out better training, standardize the handoff process.
And the result?
A 40% reduction in those errors. That really shows how linking EHR data with a QMS process can drive real change.
Wow, 40%. That's significant. It really highlights the synergy between the two systems.
Definitely. And it's not just EHRs and QMS, though they're central. The materials also mention other tech.
Like AI.
Yeah, artificial intelligence and machine learning. Using them to analyze those huge data sets, maybe predict risks before they happen, or personalize care plans.
Okay, that sounds pretty futuristic, but it's happening now.
It's starting to make real inroads. Also, things like strategy management software, ClearPoint Strategy was mentioned to keep QI projects aligned with the hospital's main goals, and digital training platforms just to keep staff updated easily.
So for someone listening, maybe working in healthcare, what are the really practical takeaways, the action points?
Based on that QI playbook wisdom, number one is integration, making sure EHR and QMS systems talk to each other smoothly. That seamless data flow is key for real-time decisions.
Okay, integration first.
Second, really lean into the data analytics within these systems. Use your KPIs, monitor them constantly. That's how you spot where to focus your improvement efforts and see if they're working.
Use the data actively, not just collect it.
Exactly. And third, automation. Wherever possible, automate those routine checks and processes within the EHR and QMS. It cuts down errors, reduces the admin burden, and frees up clinicians for what matters most, the patients.
It paints a picture where tech is really embedded, isn't it? Not just layered on top.
Totally. And you think about JCI's vision, zero harm and highly reliable care delivery.
Yeah, that sounds aspirational.
It does, but with these tools, these frameworks from accreditation bodies, and this technological capability, it starts to feel, well, maybe not easy, but achievable. Less like a dream, more like a goal we can actually work towards.
So many places are getting the basics in place, the EHRs, maybe a QMS.
Right. But the real leap forward, the full potential, is probably in that deeper integration, using more advanced analytics, moving from just collecting data to intelligently using it to constantly get better.
Okay, so wrapping up this deep dive, key takeaways for our listeners.
Mm-hmm.
Accreditation bodies like JCI, NABH, ISQA, they provide the crucial frameworks, the standards.
Yeah. And technology, especially EHRs and QMS, acts as this powerful engine enabling healthcare to meet those standards through data insights and better processes.
It's all interconnected, global standards, national efforts, the tech itself.
Definitely. So the final thought maybe for you listening, given all this, the standards, the tech, the drive for improvement, where in your world, your area of interest or work, do you see the biggest opportunity?
Where could you leverage these tools to really push healthcare quality forward?
Yeah, it's an ongoing evolution, right? And understanding it, engaging with it, that's how we all contribute to making healthcare better and safer for everyone. It's a really important conversation to be a part of.